I'm with Erica Lang, a BodyTalk practitioner at Global Health Clinics, and Cathy, who's been a client of hers on and off over the last 4 years, but in particular the last 4 months. Cathy, would you explain some of the situations you've been dealing with your health over the last few years and expand on that into how Erica came into your life and the help she's been providing for you?
Okay. A few years ago, 4 years ago, I was diagnosed with CLL, a form of leukemia, and was advised to see Erica through a naturopath, and I've been seeing her on and off probably once a month for 3 years after that. But then in the last 4 months I've been on a course of chemotherapy because of having a molar pregnancy. So at 54 years of age I was diagnosed as being pregnant and miscarrying, and the offshoot of that is a cancerous kind of metastasizing into my lungs, and so I decided I'd better see Erica a bit more, because previously she'd boosted my energy levels and the feeling of vitality, and I needed that to complement the chemotherapy that I was having, or we could say counteract the chemotherapy effects. So I've been seeing Erica on a regular basis in the last 4 months of chemotherapy. I've had 8 cycles and I've been seeing Erica once a week. She's helped me with various pain relief, the feeling of giving me more energy, more support around my general well-being, and I've maintained a level of fitness and vitality that they haven't seen at the hospital with this particular form of chemotherapy treatment. And I would say that that's due to the BodyTalk that I've had with Erica.
Erica, would you just briefly explain what's actually involved in a session? How long does a session take? And what do you do? I mean, what does Cathy have to do? Is she lying down? Is she...
If it's a new client, it's a 90-minute session, so I take a full case history and we look at the whole emotional, physical history of the client, everything from birth to now. And then during that first session, that's a 90-minute session, during that first session we'll also do a session as well. And what that involves is the client actually lies fully clothed on the bed, and we're basically looking at where the communications have broken down in the body-mind system. BodyTalk's all about reconnecting the energetic pathways within the system. And when we're in full health, all the systems, all the atoms are in constant communication. It's one light-filled, communicating, integrated system. And due to the stresses of everyday life, emotional pressures, traumatic events, environmental toxins, these systems begin to break down, and ill health and disease is generally the result.
Eric, you talked about the light body system. Is that a little bit what Chinese medicine is based on? I know you trained in Chinese medicine at one stage, and is BodyTalk an extension of the principles of Chinese medicine?
Yes, that's right, John. I began my healing career or journey as an acupuncturist, and I'm very deeply grateful for the Chinese system of looking at health. It's a very precise, wise system of viewing the body as a whole, that the emotions, the physicality and the thought patterns are one integrated whole, they are not separate, and that our thoughts and our feelings affect the physiology. So that events that have happened in our past, sometimes way long ago, we've completely forgotten about, they're still active. The memories are still alive. They still have an emotional charge on them. And they're informing the physiology today, even though they happened a long time ago. So when the body's caught in these kind of old cycles, it's important to bring those to the surface, and then the healing and the communication between the systems can be re-established. You might like to say, Cathy, about some of the experiences you've had with the dryness in your mouth. And
yes, the chemotherapy unfortunately causes a drying out of all the mucus membranes in your body, starting from in your mouth and going right down to your anus. So Erica has worked through that with me each week as the chemotherapy has taken more of a toll. She's worked on certain areas that I'm feeling pain in. For example, my lungs were the first one. She started, I beg your pardon, my mouth was the first one, and Erica worked with the ulcerating system that starts with very quickly with chemotherapy, and I didn't ever develop full-blown ulcers in my mouth. And then she moved on to the lung area that was causing me quite a lot of pain, especially when I'm just breathing. It was causing pain. And after the session, first session she did, I had no pain at all. It comes back with each cumulative chemotherapy treatment. But once again, with the BodyTalk once a week, and working on those particular areas that I was feeling pain in, the pain had completely gone by the end of the session.
And people, are there many discussions involved? I mean, are you involved in question and answers with the client, or are you more working at a kinesiology perspective?
Well, I work in both ways. When the client comes, we always have a time when we're sitting together, and I'm finding out exactly what's going on for the client, what physical symptoms they have, what emotional symptoms, what's going on in their life. So every time we're in a conversation about that. So I'm kind of gathering the information, and then once I feel like I have enough information, the client lies on the table, and then we begin the session, which is based on A, the information the client's given me, and B, a form of subtle muscle testing, which is a form of biological neurofeedback. So I'm getting information from the client's innate intelligence.
So each session you'd be dealing with what the client has as their perceived priority and the biofeedback that you're determining. So you're focusing on the priorities each session, are you?
Exactly. And every single session is different.
So it's a very client-centric process.
Very
You're not doing it at any standardised level with one treatment fits all. Each time it's a personalised, individualised session.
Exactly. It's exactly tailored to the client. And the wonderful thing is that because I'm muscle testing to see exactly what's a priority for healing, it's not even my agenda. As an acupuncturist, I could say, okay, I think the kidney meridian, this meridian's out of balance, and make a treatment according to my diagnosis. However, with the BodyTalk, because I'm relying on the muscle testing, I'm actually finding what is the priority for healing from the deeper wisdom of the client. And therefore, we only heal what the body's resourced to heal.
Right.
Because sometimes you can go in as a practitioner and say, right, I think it's this and this and this. And in fact, the body's not resourced to heal.
Yeah.
And it makes matters worse.
So Cathy, obviously, I would imagine for most people, chemotherapy would be a terrifying experience and a massive load on the body. From what Erica's just said, what sounds like she's been helping you with is, A, to deal with the overload from chemotherapy, but also to deal with issues like the fears and anxieties associated with that.
Yeah, oh, yes, definitely. Erica has, after a body talk session, she has answered my questions that I might have in that way, fearful of going into a situation, and people have actually said to me, "Oh, you're remarkably calm in this, situation, and for all that's happening to you." And I say, well, it's because I'm having some sessions, body talk sessions, that are helping me in that way.
Just one last point, Cathy. Most people I've come across and that come through the clinic doors lose their hair with chemotherapy. You don't seem to have lost your hair over the last few months.
No, I haven't lost my hair, and I haven't, it hasn't gone dry, or I haven't grown hair on other parts of my body, but I definitely haven't lost my hair, and I would say that's directly due to the fact that my health has maintained an equilibrium with the body talk.
It doesn't even seem to have thinned.
No.
Quite remarkable.
Thank goodness. Scary thing when you're undergoing chemotherapy is the thought of losing your hair and eyebrows and eyelashes and everything. No, none of that's happened. And I think it's just because I didn't get as low as others with the toxicity of the chemo and due to the body talk.
So just in summary, it would seem that the body talks made a huge difference in a very, very frightening and traumatic environment, and with your body under a huge amount of toxic stress.
Oh, definitely. It's definitely kept a level of vitality, health, fitness that I wouldn't have had if I hadn't had the weekly sessions. And that is clarified by the doctors and specialists that I'm under.